708. Let's head into the KUAM News Link Zoom room where attorney Mike Pangelinan of SHRM, that's the Society of Human Resource
Management.
Management
Yep.
Managers.
An organization that has taken on exponential value like over the last year as far as the number of edge cases that they have to consider and now work with and everything. Well, Mike, I'm sure you would agree.
Right. What's an edge case, Jay?
These little particular situations that
I got you.
employees now have, employers have to deal with, and
Thank you for human resources explaining that to us, Mike. So we brought you on here. There was a couple of mandates that came down from President Biden, but the one that a lot of people are talking about is the one the Biden administration rolled out on last Thursday. Two different vaccine rules covering more than 100 million workers. The first, of course, deadline January 4th. The first rule issued by OSHA, the Occupational Safety Health Administration, covers companies with 100 or more employees and applies to an estimated 84 million workers. Companies must ensure either that their workers are fully vaccinated against COVID-19 by January 4th or that they test negative for the coronavirus at least once a week. Workers must be paid time off to get vaccinated. We'll get into all that stuff. But I guess, Mike, obviously, I think I saw that there was already a challenge to this mandate. What are you kind of tracking from the beginning of hearing this to now?
Oh yeah, it just came out. You're right, and it's good morning, Chris and Sabrina.
Morning.
It's, we knew it was coming, right? We'd heard that that the Biden administration wanted to implement this rule that would apply, this policy that would apply to businesses with 100 employees or more. So we knew it was coming, and we didn't know what form it was going to take. And when I heard about it last week that it had come out as an OSHA standard, I thought, the first thing that came to mind was I don't want to say clever way to roll this out, but it's also, I'd probably say innovative, because OSHA, as you may know, is the Occupational Safety and Health Administration, which is part of the U.S. Department of Labor. And it is the branch, or not the branch, but the agency within the federal government that whose mission is to protect workplace safety and to promote workplace safety through regulation and through educational measures. And so, to me, when I hear that it's an OSHA standard, I think, okay, well, if you want to make this rule more difficult to challenge, this is one way to do it, because all businesses are familiar with OSHA, and OSHA really is, almost all companies are subject to OSHA. So especially private employers, they're used to having, sometimes the businesses have OSHA inspectors come out and do inspections of their workplace. In OSHA, if you look at OSHA's regulations in the federal regulation, Code of Federal Regulations, you see that there's really a OSHA standard almost applicable to everything, right? So anything you have, if there's, if you're putting up using a ladder in the workplace, or if you have a forklift, or what kind of ventilation you have to have, or your fire exits, all these things, it's heavily regulated in the sense that there's a standard, a safety standard that applies to almost all aspects of workplace. And so adding this one, this is a mandatory vaccination policy. There's already a structure in place for enforcement. You have already a set of standards. This is an additional standard, which I think, kind of makes it a little bit more difficult to challenge, because OSHA has a track record of protecting workplace safety. And so what they did in this case is they came up with an emergency temporary standard. Normally the standards are going to be promulgated over time, right? So they have public comment, and there's a whole process that they go through that takes time before they actually roll out a new standard. In this case, they've got their law, which created OSHA, which says that if OSHA identifies a situation or circumstance that puts employees in the workplace in grave danger, they can do an emergency temporary standard and put something in place immediately. In fact, they're required to act immediately if they find that there's a grave danger to an employee in the workplace. And so what they've done with this standard is they've said there is a grave danger. And the way they've articulated the grave danger, they say the grave danger is unvaccinated employees are in grave danger of getting COVID and being hospitalized and potentially dying from COVID. And so it's the unvaccinated employees that they believe are the employees that need to be protected and that are in grave danger. And the way that OSHA has determined to address that, the best way is through vaccination. And how do you get people to get vaccinated? You create a standard that says if you're going to work in a workplace with 100 employees or more, you have to be vaccinated. They have alternatives. There's alternatives to that. The alternative is either your policy can be that you require vaccination, or you can opt to have weekly COVID tests at least once a week. If you don't want to be vaccinated, you can be tested and present a negative test once a week. And so, and then they've built in there, of course, is all the familiar sort of exceptions that we've heard about, right? So it's not going to apply. Well, in one case, it's not going to apply to employees that are not actually in the workplace. So if your employees routinely work remotely, or if you're even a particular employee that always works remotely, that employee will not have to be vaccinated or submit to weekly tests. But once they re-enter the workplace, if it's an employee that works remotely and then they're going to transition back to in-person, then within 7 days before they go back to the workplace, they have to be tested. So it gives companies the option, of either mandatory vaccine or the alternate vaccination or testing. And it's, looking through it, it's a really long standard. I mean, in terms of the amount of volume of detail that's in it. And the reason why part of the reason why is because OSHA really wanted to justify this, right? So they went through, this thing is 500 plus pages. It's a huge document.
Dang.
Because they wanted to go into detail, because they anticipated obviously the reaction, right? So they want to go into detail to explain why they're doing this, their policy behind it, why they've reached the conclusion that employees that are unvaccinated are in grave danger. So they go through the statistics and the CDC, findings on the likelihood of getting severe illness or dying from COVID if you're unvaccinated as opposed to if you're vaccinated. So there's lots of data that they've put in there, pages and pages of references to justify it. But the bottom line is they've implemented this as an OSHA standard, which I think is something that kind of makes it feel like sort of a natural thing. It's what OSHA always does. And there's lots of OSHA standards. People are familiar with it.
So it is coming down from on high. Literally and figuratively, it is from the commander in chief, and then it was, adopted by OSHA. So it's pretty much like at the highest level you can be, right?
Yeah, you're right. Chris mentioned it's subject to challenge. I've heard that, there's 3 or 4 governors that have already committed to challenging it. I think Florida, Texas, Georgia have already said that they're going to challenge it. But it's
Florida, what? No way. Mike, Florida, that's got to be a typo.
That's a shocker. Yeah. But and they're anticipating it, so they've tried to kind of build up their defense against that by really loading up the standard with backing and research and this and even case law. There's lots of legal authority in there to explain sort of why they have the right to do this. And they even added in at the end of the standard, it says that they're going to continue to assess this and determine that if there's no longer a grave danger to employees, then they won't continue this standard. So I would also mention that part of why that standard is it's almost 500 pages long is because it's not just a temporary standard, but it's also a proposed permanent standard. So within there, they're soliciting comment. They're saying, look, let us know how this affects you. Let us know if it's working, not working, what portions of it work, don't work, and they're considering making it a permanent standard that would end up in the Code of Federal Regulations as a permanent standard. Right now, it's just temporary. And so, I think that it's not something that should get businesses too freaked out, really, because a lot of what's in here, other than, obviously the mandatory vaccination policy is something that a lot of businesses don't have an effect. Some businesses probably already are doing that and some aren't. But there's other portions of this that are not so unfamiliar. One of the key provisions in there is that if an employee tests positive and is going through the testing, the employer has to take that employee out of the workplace and, don't let them back into the workplace until they've gotten over it and tested negative, and there's enough time has gotten by. See, those are things that businesses already do, right? And maintaining records, they want you to maintain a roster. So once you roll out your policy, you have to have a roster of your employees and what their vaccination status is. Are they vaccinated or not? And keep that record, because from OSHA standpoint, the way OSHA enforces their regulations is through inspections. If people complain about your business, an OSHA inspector may visit you, or you may get a notification. They may want to take a look and see how you're operating. So one of the things is to have a good record. And that's similar to what businesses do with their login sheets. When you go to a business, you write down your name and number. And so they've some of these things are not so different from what's already being done. But it's something that exists now. And I mean, it's part of the law. It definitely applies to most private businesses in Guam. Mm-hmm. They are looking at, they're going to see how this works, with the idea that maybe they'll expand it. It also says inside the standard, it says that they're considering making it applicable to smaller businesses. One of the two main reasons why they didn't make it applicable to businesses of less than 100 employees is, one, because they think that there's more of a danger when there's more employees, that there's more likelihood of a spread. Yeah. And then two, they know this is going to be disruptive of a business, right? So if once you're now required to comply with this, which is going to be beginning of January, it's going to affect some businesses where if they have a lot of employees that don't want to be vaccinated, it may affect their staffing. And so they know that that's going to have a bigger impact and be more difficult for a smaller business to deal with than a larger one. So that's another reason that they're not making it applicable to smaller businesses. And then they've also, as Chris mentioned, that they delayed the implementation. It's not. I know that January 4 is the deadline that they're now saying this week, and you have to be ready to comply. What the standard actually says is it came out on November 5, which is this past Friday, and you have 30 days to implement your policy, right? So by December 5, you have to have your policy. You have to start trying to comply, but they're not going to really force you to do anything. It's not going to really affect you until after January 4, because they give you 60 days before you have to implement that mandatory testing thing, right? So once you adopt your policy, and what they want to do is they think, okay, well, if 60 days, that's enough time for employees who are not yet vaccinated to get vaccinated, because it takes time, right? Most of the time you got to get 2 doses, and then you have to wait a couple of weeks after the second dose before you're considered fully vaccinated. So the whole goal is to increase vaccination rates, get as many employees vaccinated as possible. So to achieve that, they want to give businesses time to actually get there before they actually start requiring the testing. And so that's what it is. I mean, there's a few things that are in the standard that are very typical for OSHA standards. Generally speaking, when you have a workplace injury, you find out that somebody's been injured on the job, especially if it's if somebody dies on the job or somebody's hospitalized. Most of the time you're required to report that to OSHA, a fatality or a hospitalization, within fatalities within 8 hours of learning that there's a fatality, and then if it's hospitalization within 24 hours. And I think that's because that may signal a very severely hazardous condition in your business, and they want to know about it. So that's part of this standard. If someone dies from COVID, one of your employees dies from COVID, you're supposed to notify OSHA within 8 hours of finding that out. Yeah. And if they're hospitalized, within 24 hours of finding that out.
Yeah, Mike, I've got a question for you, if I may, because I remember Chris said something when we had you on several months ago, and he said so. It was an interesting point that he made. It was a little bit joking at the time, but could we actually see maybe the future of industry would be right now that organizations that are very OSHA centric, like construction companies, utility companies, they've always in the plant, they've got that big sign that says X number of days since our last industrial accident or our last injury and everything. Could we actually see that across industry where you say X number of days since our last positive employee or last infection, or the last day we had to shut down to do deep sanitization? If not for employee confidence, then maybe customer peace of mind.
Right. I think so. I mean, I think that it's, companies now, I think, promote their safety, and promote even now, right? Companies will talk about, we're a safe workplace. In their commercials, they'll show people wiping down. They show how much effort they put into safety in protecting the public against COVID transmission.
Mm-hmm.
So I could definitely see that being added to their sort of list of, how they present themselves. But speaking of construction companies, I would also mention that there's a couple exceptions on this policy. Some companies are already subject to a different standard, right? Some companies in the healthcare industry, health clinics, people that they're in the business of providing healthcare where they have a high likelihood of COVID patients being in their premises. They've got a healthcare standard already in place that they're bound by, right? So those businesses would not have to follow this. The other ones there's federal contractors have a federal contracting standard that applies to them, a COVID-related standard for federal contractors and subcontractors on federal projects. Those businesses also should follow that standard, and it would not be subject to this one. So, so there's, like I said, there's a few exceptions. Also, it doesn't apply to employees who are routinely working remotely and don't come into the workplace very often. But that's, those are the key features of the standard. I think that it's something that not a shock to businesses that this is happening.
Have you made it through all 500 pages of the report?
Not quite.
That's not light reading too. I mean, that's some pretty heavy stuff.
Yeah. So one interesting aspect of this is that it's now a federal standard, right? So and then you hear, that prior to this, we've had executive orders. So there's been local regulation that has affected private businesses and mandates in terms of how they have to operate, mask wearing, and vaccination. Now that there's a federal standard, OSHA standards, this federal standard preempts, local regulation in these areas. So an interesting question then is, if there's any conflict between, if there's a local regulation that comes out that's not consistent with this, and most likely, here it may, and the local regulation may be even more stringent than this OSHA standard. But if there's any inconsistency, this federal standard would preempt it. This federal standard is the standard to follow, because OSHA, once they implement a standard, they don't want the state or local government to do anything that's inconsistent with it. And especially if there's, and they specifically said this in the standard, if there's any local regulation, like in some states, like these states that are challenging this, they already have regulations in those states that ban mandatory vaccination policies and even ban mandatory mask wearing, right? And so this standard says that those laws are preempted by this, that those laws are invalidated by this standard that has just come out. And that's probably why you're going to get these challenges, because they've already got inconsistent local regulations in those places that would be in violation of this.
Mike, so this mandate, of course, affecting businesses with 100 or more employees. How many businesses are we talking about like that on Guam?
I don't really know what the number is. I would think, it's probably proportionately less than in other places.
Right.
But I think, in Guam, because we have, our main industry is tourism, right? So it's our hotel industry. They've got, most of those companies are above that threshold, and we've got some logistics companies, and, a lot of our big employers are government agencies, so they're not subject, local government agencies are not subject to this, but yeah, I don't really know what the breakdown would be in terms of the number that would be above that threshold.
And Mike, given that it's only been about maybe 72 hours, give or take, since the president, made that announcement and everything like that, have you, with SHRM on Guam, have your colleagues locally had any sort of talks, or have you been hearing any buzz about any sort of pushback, reactions, and everything about what that might mean here?
No, we had not yet, but the SHRM group immediately reacted. They had a briefing as soon as it came out, and it came out, in the States, right? So it was middle of the night for us, but we had one of our board members attended a 3 a.m. briefing just so that we sort of knew that it happened, and that we'd be prepared to actually explain it, to the community out here once it hit the news here.
How big is this federal appeals panel on Saturday temporary blocking this mandate, Mike? Is this you see this like happening every other day, and is it gonna slow the rollout of this thing?
No, I don't. I don't actually. I'm not. Haven't really looked into that yet on that one. So I've been focused on kind of getting the familiar with this standard. So I haven't really switched over to that. But that's next on my list.
Yeah, I would say you've got quite a lot on your plate, Mike.
Yeah.
Your agenda and your to-do list is probably like a mile long.
I can imagine this thing coming out last week and his whole calendar for this week, like blip, 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 all filled up really quick.
But I know there's going to be challenges. I know there's going to be a lot of public comment. And that's what they really want. They want public comment. They want input. And I think, they sort of, in anticipation of all the potential negative reaction, they've sort of built that into the standard where they say, they have specific questions in there. They give you a link that you can send all of your comments to, and then they're going to receive everything and kind of go from there. So that process is going to be ongoing throughout the entire time that this is in effect. But I don't think it's going to delay anything. I mean, I think that it's already delayed. The pushback that they got when they first decided to do this already caused it to be delayed until the beginning of January, because businesses pushed for that. When they knew this was coming, they said, we're going into the holidays, and we have the last thing we need now is to have more staffing challenges. Yeah. It's hard enough to get staff now going into the busy holiday season for retailers and businesses, that if we have this added obstacle, this added sort of thing that's going to further reduce our staffing, it's going to really cripple us. So because of that, they thought, okay, well, let's start this in the early January. But I don't think that they're going to let, any sort of appeals or public comment or legal challenges get in the way of implementing this, because they already sort of feel like they're waiting a little too long as it is, right, starting in January. Because if you reach the conclusion that there's grave danger, then you need to act quick. So it's hard to say, well, that's the conclusion, but we're not going to start this till 60 days from now. Yeah, I mean that's so that's.
But I mean, we're living in a time where state of emergency is the definition of state of emergency. I mean, that's right. Got to be tweaked out a little bit. So grave danger, it depends on, I guess, who you're talking to.
True.
So what work does SHRM have to do, Mike, with this mandate? I mean, I'm pretty sure HR divisions across the country and the island are trying to figure things out. So what does a business on Guam who has 100 or more employees, what do they have to do to begin kind of walking down that implementation road?
Yeah, so SHRM is there to support businesses, right? And we provide a resource in terms of helping them not only understand what the requirements are, but then offering them sort of a template for how to actually implement it, right? So the first thing businesses have to do is adopt the policy. It has to be mandatory vaccination or the alternate vaccination or weekly testing. So the business has to decide which of those two is going to be its policy, and then actually adopt it in a written policy. And so, SHRM can provide guidance on that. SHRM members have access to templates so that we can give you sort of, here's the basic format of this, and you can now kind of tweak it for your company. But so it's, I don't think it's going to be particularly difficult in terms of the sort of, the paperwork and the record keeping, because businesses generally they do a good job of keeping records now on, for COVID and for all employment purposes. So now it's just a matter of, the businesses have lots of policies, right? So here's another one. You got to adopt this sort of policy, get it in place, get it in writing, and get a system in place where once you have the information from the employees, that it gets entered into your system. Maintaining confidentiality, that's very important. All of that information is considered medical information, so you have to maintain it as confidential. But most businesses are used to doing that in other contexts. So I don't think it's going to be too hard, but SHRM will help. We'll be available to provide advice and about, to help companies have the documentation in the form that is most efficient and accessible to them.
All right. Anything in closing? You good, Jay?
Busy times for our friends in HR these days.
Yeah, HR is often, I've learned this from being part of SHRM in the last year. I'm not an HR professional, but I do employment law. But most of the board members are HR managers and professionals. And now I realize, there's over the years, they really sort of feel like second-class executives within an organization because they're sort of, people roll their eyes HR, they're just always the party poopers, always the ones that, they're not necessarily at the same level as other executives. That's the way they've always felt that they've been viewed, but not anymore, because now they're the ones that are kind of the key executives within a team over this last couple of years, because they're the ones that really have to solve a lot of the company's problems that they're going through. And so the importance of HR has really become well known over the last 18 months. And there's been so much more respect now for the HR community because businesses now realize how critical HR is to their business.
Absolutely. My dad and my sister worked in HR for many, many years. So I'm well aware like how important and how deceivingly difficult that profession is and everything like that. So nothing but respect for you and your colleagues, and thank you for your leadership in this regard, Mike. There's a lot of work ahead, clearly.
Right on, Mike. Thank you,
Jason.
Okay.
Thanks, Chris.
I'll see you. There you go,
Hey,
Attorney Mike Pangelinan of SHRM. Yeah, Jay?
And real quick, Chris, I guess since we're talking about HR real quick, the former Chief Human Resources Officer of UOG, Larry Gamboa, passed away over the weekend.
Oh.
Yeah, so he's from Agate. Really, really good guy. I've known him since high school, like a member of the Guam national volleyball team. He played